Federal requirements are 18.75% of pharmacy technician certification exams. So these federal requirement syllabus includes requirements for storage, handling, disposal of non-hazardous drugs. Those are listed as P-list drugs and U-listed drugs, and also pharmacological substances and waste. Additionally, federal requirement for controlled substances prescriptions, new prescriptions, refill prescriptions, and transfers, and also drug enforcement agencies control substance schedules. Federal requirement for receiving, storing, ordering, labeling, and dispensing a returning disposal process for loss or theft of destroying controlled substances. And also, this section of syllabus include federally restricted drug programs such as REMS, risk evaluation mitigation strategies, and also medication processing requirements for pseudoephedrine. And additionally, also includes medication recalls and FDA product serialization, tracking, and tracing of quarantining requirements according to the Drug Supply Chain Security Act. So these are content for federal requirement that covers 18.7.5% of the syllabus according to the 2026 syllabus. So let's start our 25 passing for sure questions. That means most questions can be very helpful in solving exam questions. However, you may not exactly get the same questions, but questions can be answered if you have knowledge on these most important points from the federal requirements. So let's start. Which federal agency regulate the disposal of hazardous pharmaceutical waste? Hazardous pharmaceutical waste that include chemotherapies and other hazardous substances. A. Food and Drug Administration. B. Drug Enforcement Agency. C. Environmental Protection Agency. D. Occupational Safety and Health Administration. Correct answer is Environmental Protection Agency that regulates that comes under the hazardous pharmaceutical waste under Resource Conservation and Recovery Act. So according to Act, it is a federal law regulates hazardous waste handling and also hazardous pharmaceutical waste, and those are non-hazardous substances listed as a P and U and D listed waste, and also waste storage, transportation, and disposal requirement part of this Environmental Protection Agency regulations for hazardous pharmaceutical waste. Which waste container is appropriate for partially used syringes containing hazardous chemotherapy drugs? A. Black seal containers. B. Red biohazard sharp container. C. Yellow chemotherapy sharp containers. D. Blue recycle bin. Correct answer is yellow chemotherapy trace amount waste can be goes into the trace chemotherapy waste container or into the yellow bins. However, these are for hazardous waste bin, and these black containers for arsenic toxide trioxide waste bin, whereas PPEs, personal protective equipments like gown, etc., goes into the large yellow bins containers for hazardous drug waste. When handling hazardous drugs such as chemotherapy agents, technicians are federally required to use A. Wash your hands thoroughly after handling. B. PPE, including chemotherapy related gloves and gowns. C. No PPE unless compounding, but wash your hands. D. Only safety goggles are required. Correct answer is whenever handling hazardous chemotherapy substances, technician federally required to use PPEs, that is a personal protective equipment, and that include gloves and also gowns as well. And that is according to the OSHA and also USP 100 require using the PPEs for handling hazardous drugs. Which of the following is not required to follow hazardous drug regulations waste? A. Warfarin. B. Cyclophosphamide. C. Gabapentin. D. Paclitaxel. Correct answer is gabapentin. So the hazardous waste and also hazardous drugs and their waste have a special federal regulations to follow. However, gabapentin does not come under the list of drugs that are considered as a hazardous drug. So here there are uh, two regulations. Uh, NIOSH hazardous drugs that include drugs that causes genotoxicity, teratogenicity, reproductive toxicities, organ toxicities. Whereas EPA, Environmental Protection Agency's hazardous waste include P-listed acutely hazardous drugs, U-listed drugs, and D-coded characteristic drugs. Igniting drugs, toxic drugs, corrosive, and reactive drugs comes under EPA's hazardous waste. Whereas these drugs, such as cyclophosphamide, mitomycin, menflon, warfarin, paclitaxel, etoposide, they fall under the categories for both of them, and those both regulations are utilized for handling these hazardous drug waste. A patient brings back expired warfarin tablets. How should be technicians store them until disposal? A. Quarantine from other drugs and label for disposal. B. In a locked cabinet with controlled substances. C. In a sealed, labeled P-listed hazardous waste bin. D. Label and store in the refrigerator. Correct answer is until its disposal, warfarin should be sealed and labeled as a P-listed hazardous waste bin. So, according to the EPA's, there is a P list includes acutely toxic hazardous waste such as warfarin, nicotine, arsenic, phentermine, cyanide, physostigmine, epinephrine falls under this category of P list, and those require specific procedures for handling for disposing those products. During compounding, a technician accidentally spills doxorubicin. What is the correct PPE? Single chemotherapy glove plus gown N95 respirator, double chemotherapy gloves, gown and N95 respirator, only double chemotherapy gloves, only N95 respirator. Correct answer is to handle the spill of chemotherapy drugs like doxorubicin required double chemotherapy gloves, gown, and N95 respirator in order to handle the spill caused by the chemotherapy drugs. So, doxorubicin is one of those chemotherapy drugs, and which is also those regulated under USP 800 regulation as well. A technician observed that hazardous weight container are 75% full. What should be done? A. Compress waste to make space to 50% full and discard. Fill until 100% full and close and replace container. Close and replace container at 75% capacity. close and replace container at 95% capacity? The correct answer is close and replace container at 75% capacity. Hazardous waste container should be maximum 75% should be full to prevent any further spills and contaminations. A technician stores hazardous waste container next to the sterile compounding supplies. What federal guideline is violated? A. DEA Schedule, USP 797, OSHA PPE standards, and D. EPA Separation of Hazardous and Sterile Supply Areas. Correct answer is EPA has separation of hazardous and sterile supplies areas. So therefore, it can be violation of EPA RCRA requires to have separate hazardous waste from sterile compounding substances. A technician packages expired chemotherapy tablets such as cyclophosphamide, which labeling is federally required. A. Biohazard labeling. B. Cytotoxic waste hazardous. C. Sharp container. D. Label hazardous waste. Handle with care. Correct answer is cytotoxic waste and also labeled as a hazardous. So all these products that require chemotherapy, such as cyclophosphamide, require labeling as hazardous. uh, Cytotoxic drugs hazardous label. According to National Institute for Occupational Safety and Health, hazardous drugs, the needle and sharp should be discarded in white container, red container, black container, PPE disposable container. Correct answer is biohazard waste of sharp containers like sharps and needles of especially for biohazards that goes into the red containers. That is according to the uh, federal regulations. During DEA, Drug Enforcement Agency audit, the technician is asked to destruction record for expired hydromorphone. What documentation is required for compliance? A. Manufacturer written labels. uh, Drug Enforcement Agency Form 222, DEA Form 41 for controlled substance destruction, D. EPA hazardous manifest. Correct answer is DEA Form 41, controlled substances destruction that contain the information for compliance. That also include witness for those destruction of those forms includes in those DEA Form 41 for controlled substances, Schedule 2 drugs. A technician is cleaning hazardous drug preparation area, notices ruptured vial of methotrexate. What should technician do the first? Put PPE, wipe with paper towel and wash with soap water. Spray 70% isopropyl alcohol, soak and wipe off with paper towel. C. Put on chemotherapy personal protective equipment. Follow the hazardous drug spill protocol. Call Poison Control Center and inform about chemo spill. Correct answer is put on chemotherapy personal protective equipment and follow hazardous drug spill protocol. So there is a hazardous drug spill protocol for cleaning spill associated with chemotherapy that is also according to the USP 800. Which of the following is a key provision of Prescription Drug Marketing Act 1987? Require child-resistant packaging for all prescription, prohibits the re-importation of prescription drug into US except by the manufacturer, establishes guideline for drug advertising, D. Requires tamper evident OTC packaging. Correct answer is prohibit the re-importation of prescription drug into US except by the manufacturer. Which requirement is a part of Combat Methamphetamine Epidemic Act of 2005? A. Limit the daily and monthly purchase of pseudoephedrine. All controlled substance must be kept in locked storage, mandate destruction of expired medications, create national drug monitoring program. The correct answer is limit the daily and monthly purchase of pseudoephedrine. Combat Methamphetamine Epidemic Act was designed for misuse of pseudoephedrines. To pseudoephedrine can be converted to methamphetamine illegally. So therefore, to avoid that misuse of or making conversion of pseudoephedrine to methamphetamine, there is restricted and the amount quantities of sales of pseudoephedrine per day and also total quantity per month. Which DEA schedule has low abuse potential and limited quantities of narcotics? A. Schedule 2, B. Schedule 3, C. Schedule 3, D. Schedule 5. The correct answer is Schedule 5. Schedule 5 are substances contain a small amount of narcotics and have the lowest abuse potential. For fentanyl brand Duragesic, what is required for dispensing? A. Schedule 2 drug can be prescribed by phone. Schedule 2 drug written or electronic prescription signed by prescriber. Schedule 3 can be refilled 5 times in 6 months. Schedule 4 can be transferred. The correct answer is fentanyl is a Schedule 2 drug only dispensed by written or electronic signed prescriber prescriptions. Next, first letter of DEA number, first letter of DEA, first letter of registrant last name, type of registrant such as physician, dentist, unique identifier number, or checksum digit used for validation. So the correct answer is first letter of DEA number is a type of registrants such as physician or dentist or more other professionals. So therefore here, for example, this is an example of a DEA number that has two letters here. For example, letter A refers to the physician or dentist. That is a type of registrant type. And second letter would be last name of the prescriber initials. And then digits 1 to 6 are unique identifier numbers, whereas last three digits are checksum test. So the checksum test utilizes the last three digits and calculates, they find out if that matches to the last digits. For example, in this case, after checksum, if you find out that three number, that is considered as this prescription is a valid prescription. For details on more of this, how to validate DEA number, please find out in other pharmacy prep videos, which has been explained in details about how to calculate checksum digits for validation. Which law requires temper evident packaging for OTC drug? Poison Prevention Act, Food and Drug Cosmetic Act, Federal Anti-Tampering Act, EPA, Environmental Protection Act. Correct answer is Federal Anti-Tampering Act is designed to require for safety seals and tamper evident packaging for over-the-counter drugs. Purpose of Risk Evaluation Mitigation Strategies REMS. Federal requirement for receiving, storing controlled substances. Federal requirement for storage and handling. Manage risk associated with certain high-risk medications. FDA requirement for drug recalls. The correct answer is manage risk associated with the certain high-risk medications. iPledge program prevents fatal exposure to which drug? A. Isotretinoin, B. Warfarin, C. Methotrexate, D. Lithium. Correct answer is isotretinoin. according to the REMS program, one of the program for I-Pledge is designed to prevent or monitoring isotretinoin prescription because of its huge potential for teratogenic or contraindication in pregnancy. So therefore, this requires strict regulations to follow according to the I-Pledge. Oxycodone plus acetaminophen brand Percocet, the DEA classifies Schedule 2 controlled substance, Schedule 3 controlled substance, 4 or Schedule 5. The correct answer is Percocet belongs to the Schedule 2 controlled substance. Partial filling of morphine, Schedule 2 substance, not allowed. Remaining amount must be filled within 72 hours if out of stock. Remaining can be filled anytime within 30 days, 60 days for all patients. Remaining amount must be filled within 72 hours if out of stock. When pharmacy is out of stock, only within 3 days are allowed to complete the remaining partial fill of the prescription. Which drug recall classification means the product can cause serious adverse drug reaction? Class 1 recall, Class 2 recall, Class 3, and Class 4. Class 3 recall is considered as can be serious adverse reaction. For the previous question, the correct answer is the most serious means the classification means this most serious recall is Class 1 recall. So, according to the Class 1 recall, which is considered risk level is high and can result into serious harm and death, whereas lowest or minimal health risk associated with the Class 3 recall, which is a Schedule 5 controlled substance. A. Hydrocodone plus acetaminophen, B. Tramadol, C. Methadone, codeine, guaifenesin, robitussin AC. Correct answer is cough syrup, codeine, and guaifenesin is Schedule 5 drug, which can be used in low amounts of narcotics and also have a lowest abuse potential. Medication guides, med guides are required for drug product when the FDA determine one or more following conditions present. A. The drug is available only as a over-the-counter. B. Drug has no known adverse effect. C. Patient is labeled could help prevent serious adverse effect. D. High alert drug according to ISMP. Correct answer is C. Med guides or for patient labeling could help to prevent serious adverse effect of the drug. And also medication guides, patient needs to be aware serious risk to make decision about using the product. And also medication guide helps to patient adhere direction is crucial for drug effectiveness. Which requirement under the Drug Supply Chain Security Act must a pharmacy follow before dispensing a prescription medication? A. Verify the patient insurance plan. Ensure medication has a tracking documentation as a T1, TH, TS. Report all prescription to the DEAs. Place a barcode on every vial dispense. The correct answer is DSCSA, which is Drug Supply Chain Security Act, require pharmacists to receive and store and provide product tracking information and also transaction information, transaction history, and transaction statement for prescription drug packages. So with this information, subscribe Pharmacy Prep channel for more test videos and stay tuned for more videos.